The Praxis exam in speech-language pathology is a big step. It helps you become a certified speech-language pathologist, or SLP. SLPs help people who have trouble communicating. This test covers many topics in speech and language disorders. Passing this exam shows you have the knowledge to help your clients. This essay will help you get ready. We will look at some example questions and answers. This will cover areas like how to assess and diagnose communication disorders, how to plan treatment, and how to be ethical in your practice. Let's get started. As an SLP, you need to figure out how someone is communicating. This means you need to understand different types of communication disorders. Let's look at some examples. A parent brings their 4-year-old son, Leo, to your clinic. They are seeking professional advice because they have noticed some issues with his speech. They're worried because Leo can't say the R sound correctly, which is causing some frustration for both Leo and his parents. He replaces it with W, saying wabbit instead of rabbit. This substitution is quite common among young children, but it has persisted longer than his parents expected. What is the most appropriate next step for the SLP? The decision here is crucial and can impact Leo's speech development significantly. A, diagnose Leo with a speech sound disorder and recommend therapy. This might seem like a direct approach, but is it the best one? B, explain that this is typical development and no intervention is needed. This could reassure the parents, but might it overlook potential issues? C, gather more information about Leo's speech and language development. This option involves a more thorough investigation into Leo's overall communication skills. D, refer Leo to an audiologist to rule out a hearing impairment. Hearing issues can sometimes affect speech, so this is a valid consideration. The answer is C. Gather more information about Leo's speech and language development. This comprehensive approach ensures that no aspect of Leo's development is overlooked. While it is common for young children to have difficulty with some sounds, it's important to gather a comprehensive history. This includes understanding Leo's milestones, his interaction with peers, and any other concerns the parents might have. You'll need to look at Leo's overall development. This means considering his cognitive, social, and emotional growth alongside his speech. This will help you decide if his speech is typical for his age or if it needs further assessment. By taking a holistic view, you can provide the best support for Leo and his family, ensuring that any intervention is both timely and appropriate. You are evaluating a 10-year-old named Sarah, who repeats sounds and syllables when she speaks. She also blinks her eyes a lot when she talks. These behaviors have been happening for over a year and are affecting her schoolwork. What type of fluency disorder is Sarah most likely exhibiting? A, cluttering; B, stuttering; C, apraxia of speech; D, dysarthria. The answer is B, stuttering. Stuttering often involves repetitions of sounds or syllables. People who stutter may also show physical tension like blinking or facial grimaces. This usually starts in childhood and can affect school and social life. Section 3. Treatment planning, crafting individualized interventions. Once you've figured out what's going on, you need to make a plan to help your client. This plan should be specific to their needs and goals. Question 3. Setting goals for language intervention. You are working with a 6-year-old named Emily who has a language impairment. She has trouble following multi-step directions and understanding complex sentences. Which of the following would be an appropriate goal for Emily's intervention? A, Emily will correctly produce all speech sounds in isolation. B, Emily will follow 2-step directions with 80% accuracy. C, Emily will independently write a paragraph with correct grammar. D, Emily will maintain eye contact during a 5-minute conversation. Answer B, Emily will follow 2-step directions with 80% accuracy. Explanation. This goal is specific, measurable, achievable, relevant, and time-bound, also known as SMART. It targets Emily's difficulty with receptive language skills and sets a clear criterion for success. Question 4. Addressing pragmatic language deficits. You are seeing a 9-year-old boy named Ethan who has difficulty with pragmatic language. He often interrupts others, has trouble understanding jokes, and makes inappropriate comments. Which of the following strategies would be most effective in addressing Ethan's pragmatic language deficits? A, provide Ethan with a picture book about different social situations. B, engage Ethan in role-playing activities to practice appropriate social skills. C, have Ethan complete worksheets on identifying emotions and facial expressions. D, teach Ethan relaxation techniques to manage his impulsivity. Role-playing provides Ethan with opportunities to practice pragmatic language skills in a safe and structured environment. It allows him to experience different social situations, receive feedback, and learn appropriate ways to interact with others. Section 4. Ethical considerations. Navigating professional dilemmas. Ethics are very important for SLPs. You need to know how to make good choices that protect your client's well-being. Question 5. Maintaining confidentiality. A teacher approaches you, the school SLP, and expresses concerns about a student in your caseload. The teacher is worried about the student's progress and wants to understand more about the student's challenges. The teacher wants to know the specifics of the student's diagnosis and treatment plan. They believe that having this information will help them better support the student in the classroom. What is the most appropriate response? As an SLP, you must carefully consider your ethical obligations and the best interests of the student. A. Share the student's information with the teacher, as it will benefit the student's education. This option might seem helpful, but it could breach confidentiality. B. Refuse to discuss the student's information and report the teacher's request to the principal. This might protect confidentiality, but could strain your relationship with the teacher. C. Explain the importance of confidentiality and share only general strategies used in therapy. This balances maintaining confidentiality while still providing useful information. D. Suggest the teacher contact the student's parents for more information. This ensures that any specific information shared is done with parental consent. As an SLP, you are bound by ethical guidelines to maintain client confidentiality. These guidelines are in place to protect the privacy and trust of the students and their families. You can explain that you cannot disclose specific information without the students' or parents' consent. This helps maintain trust and ensures that sensitive information is handled appropriately. However, you can share general strategies and suggestions to support the student's communication in the classroom. These strategies can be very effective in helping the teacher support the student's learning and development without breaching confidentiality. Collaboration between the SLP and the teacher is crucial. By working together and respecting confidentiality, you can create a supportive environment that fosters the student's growth and success. Remember, maintaining confidentiality is not just a legal obligation, but also a cornerstone of ethical practice. It builds trust and ensures that students and their families feel safe and respected. Always prioritize confidentiality while finding ways to support your students effectively. This approach will help you navigate complex situations with professionalism and care. Question 6. Obtaining informed consent. You are recommending augmentative and alternative communication, AAC, for a student who is nonverbal. This recommendation is based on the understanding that AAC can provide a voice to those who cannot speak, allowing them to express their needs, thoughts, and emotions effectively. The parents are hesitant to try AAC because they believe it will prevent their child from learning to speak. This is a common concern among parents who may not be familiar with the benefits of AAC. They worry that reliance on an AAC device might replace the need for verbal communication. What is the most important factor to consider when counseling the parents about AAC? It is essential to address their concerns with empathy and provide them with comprehensive information. A. Respect the parents' decision, as they are the ultimate decision makers for their child. While respecting their decision is crucial, it is equally important to ensure they are making an informed choice. B. Present evidence-based research that shows AAC can facilitate speech development. Sharing studies and data that demonstrate how AAC can support and even enhance verbal communication can help alleviate their fears. C. Emphasize the importance of early intervention and the potential benefits of AAC. Early intervention can play a significant role in a child's development, and introducing AAC at an early stage can lead to better outcomes. D. Provide the parents with brochures and resources about AAC to review on their own time. Giving them time to digest the information at their own pace can help them feel more comfortable with the decision. Providing accurate and evidence-based information is crucial when obtaining informed consent. It ensures that parents are fully aware of the potential benefits and limitations of AAC. Parents need to have a clear understanding of both the benefits and limitations of AAC, including its potential to support rather than hinder speech development. By addressing their concerns and providing thorough information, You can help them make a well-informed decision that is in the best interest of their child. It's also important to highlight success stories and real-life examples of children who have thrived using AAC. These stories can provide hope and reassurance to parents who are uncertain about the effectiveness of AAC. Ultimately, the goal is to empower parents with knowledge and confidence, enabling them to make the best possible decision for their child's communication needs. By fostering a collaborative and supportive environment, you can help them navigate this important choice with clarity and assurance.